Hi there, my name is Dr. Mark McRae, a board certified plastic surgeon from McRae Plastic Surgery. We just wanted to go over our enhanced recovery after surgery protocol. And this is just the preoperative part the portion that you as the patient need to be aware of to participate. Now, just to be, as a quick side note, is that this is not necessary. This is something that is going to try to minimize your risks and improve your recovery. If any single step of this is not performed, it is not critical. This is the idea that such as something that we would do in elite athletics. This is elite surgery. So we're looking for every little edge to get you the best outcome possible. But again, this isn't necessarily the standard of care, but we think it is the best care possible. So before your surgery, this is what we're focusing on today. On the day of surgery, you're going to actually get medications and things done to help you with your recovery as well. Certain medications that we give different pain medications before surgery, nausea medications, things that improve or decrease the amount of bruising and bleeding. But that's nothing that you need to be concerned with. That's something that we will take care of. I mentioned again here, do not panic if you are not able to complete, or if you don't have the proper soaps or anything like that. Not any single step is absolutely necessary. They might help you just that little bit. So 4 to 6 weeks before your surgery, what can you do to optimize yourself and be ready? Well, one is ensure you have a very good diet. So consider your protein intake and consider supplementation of protein if needed. Vitamin C is also another supplement that may be helpful. Make sure you're not deficient in that area. Make plans for your recovery period. So make sure, especially in that first 2 weeks after surgery, you're not planning any kind of face-to-face meetings, that you have everything taken care of in terms of your food after surgery. Make things nice and easy on yourself so that plans are made so that you can take the stress off yourself after surgery just to allow yourself to recover. Do not smoke or vape nicotine. And this really is a very important step for healing, at least 6 weeks before and after surgery. This is one of the biggest things that can be done to prevent complications and improve healing. And then finally, limit your alcohol and marijuana use. I think in general, this is probably a good idea for life, but certainly for 1 week prior to any surgery. The other thing that, although marijuana use hasn't been linked necessarily to poor healing, the act of smoking and inhaling marijuana does lead to more reactive airways. And so, in terms of going under anesthetic and waking up, limiting any kind of smoking or irritants to the lungs is very helpful as well. So 1 week before surgery, you want to make sure you're not taking over-the-counter blood thinners. Many patients now, especially in older years, are on different blood thinners for things like atrial fibrillation and other issues. Make sure those have been stopped according to whatever the preoperative plan is. Also aspirin, don't be taking aspirin. Stop things like non-steroidals, such as Advil, Motrin, and Aleve, and then stop taking vitamin E and herbal supplements. Now, occasionally some NSAIDs might be necessary for you, but again, discuss that with us if you do plan on taking those. There's many supplements or multivitamins contain things like turmeric, ginger, ginseng, garlic, St. John's wort, kava, and green tea. Those are all things to generally avoid in terms of limiting things like bruising and bleeding during and after surgery. Okay, so 3 to 7 days prior to your surgery, we want you to reread that surgery package that we had you sign in terms of your consent. Now, it is extensive, and it kind of has every, well, not every possible, but many possible issues that can happen during surgery. It's not meant to scare you in any way, but it's just the things to be aware of. But in that package, we also have, preoperative and postoperative care instructions, and all those things are nice for you to be aware of before you have your surgery. It's something that can also help you mentally prepare for your surgery and recovery. And if you have any clarification questions at all, please do ask them. Reach out to our office and we will get an answer to you. Now, 3 days prior to your surgery, we do recommend doing antibacterial washes. Okay, and I think this is something, the idea is just to kind of decontaminate and try to limit the bacteria on the body or in the area that you're having surgery. These body washes with antibacterial soap, we recommend doing them 3 days prior, twice a day, and then the morning of surgery. Dexedin detergent, or Dexedin is a chlorhexidine wash that's available on Amazon or at most major drugstores. That is a good product that we do like. It isn't always available, so there can be shortages. Really, any antibacterial soap will work. If you're using Dexedin, you can't really use this on your face or in your hair, so be aware of that, as particularly if you're having a facial procedure, facelift, then you wouldn't be using Dexedin on your face. But keep your bedroom clean and keep your sheets clean the night before your surgery, certainly, but also a few days before is a good idea. Make sure there's no pets sleeping in your bed. Those pets are very cute, but they have lots of bacteria, saliva, and other things all over themselves that they're bringing into your bed and into your bedroom, and that's going to put you at risk for infection after surgery. I've certainly seen this, and I think that this is easily preventable. This is just a close-up of that Dexedin product, but again, it doesn't have to be Dexedin it can be any number of antibacterial soaps, and you can just ask your pharmacist. 3 days prior, another thing we can recommend, and it isn't necessary, but something helpful, mupirocin. It's available by prescription. It's called Bactroban, and this is something that is used as a small pea-sized droplet. Apply it either to your fingertip or generally a Q-tip or a cotton swab, and then apply it just into the inside of the nares, and then inside the ears, and in the depth of the belly button. This is something that, again, isn't entirely necessary, but for people that are colonized with certain bacterias, there's something called methicillin-resistant Staph aureus that is in the community now, and as well as in hospitals. So it depends on what your risk factors are. But in general, if it can decolonize people of these kind of bacteria, which are present in the community now, we do think that this is generally a good idea, even though your risk is most likely low. And so again, this is just the idea that we're kind of doing every little thing we can to prevent complications. So fluid intake, and another idea is that we want to be kind of tanked up for surgery and ready to go. After surgery, sometimes people can become nauseous from the narcotics that are given, from anesthetics, and so we like you to be kind of tanked to be full. How do we do that? Well, the evening before surgery, we do recommend a carbohydrate-rich drink. And this is a bit counterintuitive because generally speaking, we don't recommend people drinking juice or carbohydrate drinks in general. Those aren't healthy. But before surgery, it is. So clear apple juice, 3.5 cups, or cranberry cocktail, 2.5 cups, or sweetened iced tea, 4.5 cups, just in terms of the amount of carbohydrates you're going to get from that. That really does kind of help fill the tank for you because, again, surgery does require those carbohydrates, and it's nice to kind of make sure you're tanked up. The morning of surgery now, in some cases, in our Burlington location, our whole team is very much on board with this, of having a clear carbohydrate-rich drink in the morning. Now, this is the only thing you can drink or eat. Remember, you cannot eat or drink anything after midnight before your surgery in order to minimize your risk of any issues with the anesthetic. So that's a really important thing. But these clear liquids you can have. And that would be clear apple juice, and that should be taken about 3 hours before your surgery, no sooner than 2 hours before your surgery. So if you're scheduled for 1 p.m., make sure you're done drinking your clear apple juice, 2 cups in this case, before, at around 8 a.m. Great. Now, if you're having surgery with us in our Toronto locations, then make sure you just discuss this with us beforehand. And most likely at this point, you wouldn't be having that drink in the morning. You'd only be having your clear fluids the night before surgery. Just some day of surgery reminders. This is in your packages. But if you wear glasses, contacts, hearing aids, bring a container with them with your name on it. That's helpful for our nurses. If you use inhalers, make sure to bring them in their original containers so they're kind of labeled as what they are. If you use CPAP, sorry, it's a CPSP, that's an error. If you have CPAP, make sure you bring it with you. If you're a diabetic patient, please bring your glucometer reader with you. Um, Always wear non-slip footwear, and then wear loose, comfortable clothing. Button front or zippers are preferable to pullovers, and leave all your valuables at home. No jewelry, piercings, lotion, makeup, lipstick, perfume, cologne, hairspray, hairpins, or dark or metallic nail polish. You shouldn't have any of those things, and please no tampons as well. Finally, make sure you brush your teeth. And don't swallow. Just make sure you spit the toothpaste out. And finally, don't chew gum before surgery. Okay, so those are some basic reminders for you. We want you to really enjoy your day with us. We have a wonderful staff. They'll really take excellent care of you. They'll help you with all the medications and everything you need on the day of surgery and afterwards. We keep in good communication with you as well after your surgery and your recovery process. And we'll have another video that kind of discusses your recovery process and what you can do and what we do to really maximize your recovery and minimize any complications. Thank you so much for your attention. Have a great day.